Welcome back, Amber.
Nice to see you.
Good to see you as well. So I understand that you have a problem with your knee, leg, and foot. So what happened?
Well, I'm a gymnast, and I was on the bar, the high bar, and I slammed my foot into the lower bar.
Okay, left or right?
My left foot.
Your left foot.
Yeah, and it has like a bruise on it, so my big toe is in a bandage.
Okay. When did this happen?
About a week ago.
A week ago. And did you hurt only your foot or
I just hurt my foot, but sometimes I get like weird feelings.
Weird feelings?
Like sometimes it feels like on my feet that I'm wearing socks when I'm not wearing socks.
Really?
Yeah, like it's kind of fuzzy, and then there's like tingly sensations. They start on my foot and they go up my leg.
I see. And how about your knee?
It goes up there as well.
Okay. So you feel like you're wearing socks when you're not. Any tingly sensations, any numbness?
Yes.
In your foot, your leg, knee, or all three?
My foot gets numb, but my knees just get tingly.
Do you have any pain?
In my feet, but not my knees.
Okay. Any numbness of feeling like, you're touching certain areas of the skin and you can't really feel that touch?
Sometimes on the bottom of my foot and on my kneecaps.
On your kneecaps? Interesting. Okay. And did you do anything right after you had the accident? Any hot, cold presses? Any medication?
I took some over-the-counter painkillers.
Okay.
And I also put ice on it, but I didn't do a hot pack.
Okay. Are you allergic to anything?
I don't believe so.
I'm not seeing any discoloration on the skin, no bruises. But I'm going to go ahead and do a very thorough medical examination of your knee, leg, and foot. I don't like the fact that you're feeling phantom sensations. That can sometimes be an indication of something neurological happening, nerve damage. So I do want to investigate that a little bit more in depth. Do you feel anything else that stayed on your mind because it's just so unusual?
No.
Okay. Any burning sensations?
I don't think so.
Okay. How about anywhere else on your chest, arms, fingers, face?
It's just in my legs.
Just in your, so lower extremities are mostly impacted. And how bad was the accident?
It was pretty bad.
Pretty bad. Did you lose consciousness when you fell?
No, it just, it hurt to walk for a few days, because I slammed it real hard.
Okay. All right. So let me go ahead by taking your vital signs first. I'll put on my gloves, take your vital signs, and then we'll focus on the cranial nerves and your knee and your legs.
All right.
All right. Alright, do you mind lifting up the leg a little bit just so that I can take a better look at the knee? Okay. I got my nitrite here. Do you feel me touching you right now?
Yes.
Okay, so you feel the tapping sensation. I'm going to go ahead and palpate. And I'm going to check the patella and the kneecap. And down the tibia bone. Do you feel this?
Yes.
That's a good sign. Okay. Gonna go ahead and take some measurements and check the symmetry. So I'm not seeing any inflammation. That is obvious. Do you have any pain right now in your knee?
No. It's actually hard to feel a little bit, the part that's on my kneecap.
Okay. Right there?
Yes.
Do you feel this?
A little bit. I feel it when you're further down, but not like right here.
Okay. How about this? Do you feel that?
Yes.
And this?
Not really.
And this?
A little bit.
Do you feel that?
A little bit. On my left.
Okay. How about here? Do you feel this?
Yes.
Alright, let's do a test that's called sharp or dull. So this is very sharp. Let me know if you feel it. Okay. And this is dull. Do you feel that?
Yes.
And how about here?
Yes.
Okay, and this?
Sharp.
Okay.
Dull. 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 Sharp.
Okay.
Dull. Dull. Sharp. Dull.
Now I'm going to check the sensitivity to vibration. So just keep your eyes closed and tell me if you feel this.
Yes.
Okay.
Yes. A little bit.
A little bit only. Okay, let's try a more intense one. Did
A
you
little
feel that?
more. I think a little bit.
And right on the patella. Do you feel this?
Not really, no.
Interesting. Okay, let's try something that places an equal amount of pressure on the patella. Do you feel that?
No.
No. Okay. How about that?
Like a little bit. A little bit there as well. No. Yes. Yes. A little bit. A little bit as well. Yes.
Okay. Do you have any pain there?
No. 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 No.
Okay. And I have here an object that is cold and one that is hot. Continue keeping your eyes closed and just say hot or cold.
Hot.
Okay, that one is correct.
Cold.
It's correct.
Hot. Cold. Hot. Cold. Cold. Cold.
Okay. Six. 7.2. 5.2. And 9. 8. And 8.5. 10. 4.2. Okay. I'm just checking the proportions. Okay, so we did have a little bit of a mixing of the sensations, hot and cold, and you have some loss of sensation in the patella here. The bones are intact. Your tibia bone is just fine. Sharp and dull, and vibration sensitivity is intact. Right, let me go ahead and take your vital signs, and then I'm going to have you lay down, and I'll take a more in-depth look at your legs and your plantar region of your feet.
Okay.
Okay, let me just go ahead and take the temperature first. Have you had any flu-like symptoms in the last 2 weeks?
No.
Okay. Just gonna go over the forehead and behind the ear. 98.4, so do not have a fever. And let's check the levels of oxygenation. Okay, I can just place this right here and just relax your hand. And I'm gonna go ahead and listen to your heart and lungs. Okay. Just breathe normally. A little bit of an elevated heart rate. Good. Okay, 98% oxygenation and about 105 for your heart beat. Take a deep breath in and out. In. I'm looking for any hissing sounds, any murmurs. Lungs are clear. Good. All right, let's have you lay down and take a closer look to your legs and feet. Okay, Amber, is it okay if I remove your socks?
Yes.
And I see the left foot that is bandaged up. Going to do just visual inspection first. Not noting any bruising, no abnormal colors. Skin response to UV light is normal. No micro lesions are present. Going to palpate your legs and check for any signs of edema. Actually, I'm going to check the temperature first, since I am noticing that you are a little bit too cold on this foot. Yeah, definitely. Not so much this one. Your right foot is much more cold than the left one. Okay, I'm going to check your pedal pulse. 2 plus, synchronized. Good. No signs of edema are noted. Okay, I'm going to inspect in between your toes. Going to check the popliteal pulse too. Good. Alright. Let's test the dermatomes on the front region of your legs and your feet. And we're going to do the same sharp or dull test that we did on your knees. So can you tell me if this is sharp or dull? Dull. Okay, good. Sharp. Okay. Sharp. Okay. Dull. Dull. Sharp. Sharp. Right. Dull. Dull. Sharp. Sharp. Dull. Sharp. Okay. Very good. Now, can you wiggle your toes? Good. And while I press down on your left foot, can you slightly lift your left arm? Okay, good. Now I'm going to press down on your right foot. Can you lift the left arm? Okay, good. Perfect. Now can you lift both of them? Okay, you have strong back muscles. Can you push into my arms with your feet? Good. Can you wiggle this toe? Okay. And can you wiggle the one that's bandaged? Okay, good. Can you tell me which toe I'm touching you?
My pinky toe.
Okay. And how about now?
My big toe.
Okay. And how about now?
My big toe.
Good. And how about now?
My fourth toe.
1, 2, 3, 4. That's right. Okay. I'm going to spray some water on one of your legs. Can you tell me if it's the left or the right one?
Left.
Okay.
Right. Right.
Good.
Left.
Good. And let's test the sensitivity to vibration. Just say yes if you feel a vibration.
Yes.
Okay.
Yes. Yes.
And do you feel this?
Yes.
Okay. Just say now when you stop feeling the sensation.
Now. 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 Now.
Good. Okay, your ankles are not swollen. I'm gonna go ahead and tap on the bones, especially the phalanges, and I want you to let me know if you feel any pain.
That hurts a little.
This hurts a little here.
Mm-hmm.
Okay. Did you feel that?
Yes.
How about that?
Yes.
Okay. And is this sharp or dull?
Dull.
How about this?
Sharp.
Okay. I'm not noting any nail clubbing or pitting. And capillary refills within 2 seconds, so good blood circulation. The phalanges are intact, ankles are not swollen, dermatomes are alright. Okay, let's go ahead and flip face down so I can take a look at the plantar region of your feet. Can you wiggle your toes? That's good. Going to do the Babinski test. So if you can leave all your weight into my hand here. Okay, that's negative Babinski on the left foot. And to negative Babinski on the right one. Eight. 7 across the calcaneus region. And 7. Okay. Do you feel any pain here?
No.
And how about there?
No. No. No.
Okay. Can you curl your fingers, your toes around my finger? Good. And now release. And curl your toes again around my finger. Good. I'm going to test your sensitivity to vibration. So just say yes when you feel the vibration.
Yes.
Okay.
Yes.
Good.
Yes. Yes.
Good. And now I want you to tell me if you feel this.
Yes.
And this.
Yes.
Okay. And now just say now when you stop feeling that feeling.
Yes. No. No. No.
Any loss of sensation?
No. No.
Okay. That's good. Now we're going to do the same hot or cold test that we did earlier on the plantar region of your feet. So go ahead and say hot or cold.
Hot. Cold. Cold. Hot. Cold. Hot. Hot. Cold. Hot.
Okay. You feel this?
Yes.
And this?
Yes.
And I'm going to spray you on one of your feet. I want you to say left or right.
Left. 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 Right. 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 Right.
Okay. Do you feel that?
Yes.
Okay.
Yes. Yes.
Alright, next up I'm going to perform some acupressure therapy to stimulate the nerve endings in the plantar region of your leg and increase circulation, promote health, relaxation. Gonna go ahead and put your socks back in your feet. I think I didn't put this on too well, so I'm gonna just redo it. There we go. Okay, Amber, so I did a very thorough medical assessment of your knee, your legs, and your feet. You did mix a couple of the hot and cold tests that we did, so I want to monitor you for potential nerve damage. I'd like to see you back in about a month, and until then, try to not put too much pressure on your foot. Try to rest up as much as you can. Don't wear high heels if you're in the habit of doing that.
Just a little bit.
Just a little bit. Maybe just try to avoid just until we get to the bottom of what's going on with your nerves. Do you have any questions for me today?
No.
Okay, great seeing you.
It's good to see you.